My name is Brady Barker. I'm an orthopedic surgeon here in Provo and Orem, Utah, specializing in all musculoskeletal care, in particular in reconstruction of diseased hips and knees. We always try to do the least invasive thing possible. So with hip arthritis, it's usually starting with activity modification. So we'll put them on using a cane. We'll talk about weight loss, try to take away some of the pressure on that affected joint. Then we'll talk about anti-inflammatory medications, things simple as over-the-counter like ibuprofen or Aleve. As those start to become less effective, then we start getting into a little bit more of the invasive things, and we'll talk about cortisone injections. If those fail to restore the patient's ability to enjoy life, then we talk about at the last stage, hip replacement. The technology today has gotten so much better, and one of the things in the past that's limited us is just the lifespan of the joint prosthesis. It consists of a metal shell that goes into the hip socket itself. There's a metal stem that goes down inside of the top of the femur, and then there's a metal or ceramic ball that goes on top of that, and then there's a plastic liner that goes inside of this. And this has really been the thing that limits the longevity of a hip replacement, is the liner. So the plastics have gotten better and better to the point now where we can a lot of times say your hip should last for 30 years in most cases.